It's 7:03 and we have only a smattering of people in the auditorium. And there are more senior faculty than the younger Turks. That's perhaps a sign of the times. But it's time to move on. This is, to my mind, quite the most important session because it gives me glimpses of how one can grow, how one can cope with situations. I want to introduce three of, I think they are legends, and you are the best judge. Adarsh Chaudhry is certainly one of India's finest GI surgeons. He's well known for his academic excellence and surgical skill. In general, it's said that good surgeons are poor speakers, and good speakers are poor surgeons. I can tell you that he's a heck of a good surgeon, and as to how good a speaker he is, I guess you know now, because he has already delivered yesterday's talk. He's had the privilege, like some of us, to spearhead pioneer the growth of gastrointestinal and HPB surgery in this country. But I think he's absolutely delivered big time in this process. He's widely read, and he says he's reading even more nowadays. A great guy to talk to, and his witty remarks can liven the dullest moments, and he can accomplish all of that without the assistance of alcohol. We know that he works in Medanta, but he does cast his spell worldwide. He's been a friend of 4 decades, and I've learned so much from him. A towering personality. That's our first of our 3 legends today. The second in the jacket is Dr Ramesh, or GN or GNR as he's popularly known. He's a GI physician here in Aster Med City. Also my contemporary and a good friend and colleague of many years. Never have I seen a medical professional so naturally good at his primary calling, and almost instinctively skillful endoscopist. It's almost as if he never trained in it, but yet he had the skills. A great and a very patient way with the patient, and an academic acumen, and I see Lekha entering here, that we've often remarked that 2 decades ago, that is, that when he did a journal review, he seemed to find more in the journal than what the authors themselves had started out to let us know or convey. Yet, despite this professional excellence, he simply had to cut a wide swathe across society, Rotary, Round Table, other such activities, social activities, counseling, guidance. Many have wondered, in fact, I have heard many people say, where does this guy get the time for all this? He's currently the Rotary District Governor, and I believe that's almost impossible to achieve for an ordinary human being. He ran the Cochin Gut Club for nearly 2 decades, and during that period, not only was he there on every Wednesday except one, am I right, Jian? But the meetings and the quality of the meetings at that time provoked many visitors like Shiv Sareen or Surinder Yacha to say that this is better than national conferences. He loves to sing, and he has made practically everybody else sing too. Had he come last evening, we might have had some entertainment from him. So, multi-talented, Dr Ramesh. The third, Rajeev Jayadevan, is a good decade younger than the other 2. He's a consultant gastroenterologist at the Sunrise Hospital, Kochi, but that's not all. After several years in the UK and the US, he returned to India, and that itself enamored him to me and to his hometown, where he has not only maintained his gastroenterologic practice, but accomplished so much on the administrative and social front. it's hard to find such a deep thinker and a super organized person. We are talking about 3 organized persons, and this is one of those very super organized people. For example, the COVID pandemic brought out so many more facets of his personality in the sense that he was the face of the medical profession. I almost felt proud that I was a medical professional in the sense that he was so organized in meeting the problems of COVID, to communicate with the lay media, the lay persons. And whenever he dealt with the Barkadats and the current tappers and international agencies, media agencies, his precision of delivery left them practically tongue-tied. And I've seen Barkadat and current tapper, tripping up most people, but they were just pinning their ears back and listening. And this is something that was quite remarkable to see. A public educator, he has taught in schools on health topics. He's just been doing it so prolifically that I can't give you I don't want to give you figures. And he's a writer. His book, Think Like a Doctor, was published a few years ago, and I was privileged to read it. All in all, I would be quite happy to call him a versatile genius, for according to me, I'm all for Thomas Alva Edison's statement that genius is 99% perspiration and 1% inspiration. I could just go on, but imagine how much he's done in this short period of time, and I cannot imagine how it would be for him to go further and further and achieve more and more. The first thing I want to say is to wish these legendary figures all the very best, good health, so that they can continue being such leaders and such a role models for us. And can I invite one of them by turn, Adarsh first, then GN, and then Rajeev to come here and give us some of their thoughts. They will speak for 7 minutes each, and then afterwards the audience can just tap into their minds. Thank you.
There's no prepared speech. I don't even know what I'm going to talk, but I'm very sure I'm not a legend at all. I'm not being modest or something. I don't know what the direction of talk is, but it's very strange that people say, what are the secrets to success? And then they are telling it to everybody. Then how can they be secrets? So there are no secrets. I don't know whether I'm successful or not, but I can tell you, I've observed successful people. I can tell you that one of the easiest ways to be successful is to be seeing someone successful and try to copy him. I was very fortunate that I was very trained in PGI, which had an atmosphere of excellence around everywhere. If you see the world today, you see Mayo Clinic, you see anywhere, there are everywhere people from my age who are chairmen and who are doing well. Ramesh is here, both Rameshes are here. We all studied together. There was something in that place, excellence surrounds you. And I sincerely believe that the people with whom you move, they affect you. Nageshwar Reddy was my neighbor in PGI, and when he became the secretary of the World Endoscopy Society, there was a small meeting to felicitate him, where 2 people were asked to speak about Nageshwar Reddy. I was asked to speak because I was his friend for many years, and Jack DeVere spoke from the European side because he knew him well. So after the talk was over, me and Jack went for a walk. So Jack asked me, what do you think is the reason for Nagi's success? I said he's been very hardworking and very committed, and he had a single-minded focus or something. And I said, what do you think has been his secret of success? So Jack said something very profound which went like a dart through my heart. He said, he's been very careful in choosing his friends. He chose his friends very carefully. If you associate yourself with nice people, people who are positive, who are better than you, I think you do well. And also, if you meet successful people, they have a lot of questions to ask. Your knowledge, your wisdom, your ability to think beyond normal people comes if you ask questions. Because no question is stupid, many answers are stupid. So if you learn to ask questions, I believe that one of my qualities has been, I don't know about others, I'm very curious. I'm very curious about things. I ask a lot of questions. I'll ask everybody, how does it happen? What does it happen? And in that, I learned, because when I was in medical school, my best friend was a compulsive gambler. He used to gamble 6 months before Diwali and 6 months after Diwali. So he was obsessed, very bright guy. So when we used to come from the hostel to the medical college, he used to tell me, what have you read? So I used to speak out to him and he used to listen to what I had read. And only by my talks, he passed all 3 professionals. So wisdom is everywhere, knowledge is everywhere. And when I was young, I asked somebody that when I talk like this, and there's some people sitting in the audience, and then they are talking, I feel very distracted. I feel sad that I'm talking, and these people are talking amongst themselves, so I'm not good enough, because they are not interested. So that kind of takes away my tempo and my interest in the talk. You are giving a talk, there are 2 guys sitting in the front row, they are snoring. One guy is seeing his cell phone. You feel, I have come all that distance. And these people are not listening to me. So I used to get sad. You travel 2.5 hours and in the audience there are 8 people. So I used to feel very sad that why does it happen? So he told me that, listen, when you go for a talk, only 5-7% people are interested in your talk. Rest 90% have come some other purpose. So you talk to only 5 to 7%. Don't let yourself be bothered about that. And that's what happens when I go to workshops and somebody is doing a procedure. You walk in and 2 guys come out. I said, what's happening? He said, useless fellow, some bleeding is going on. It is so easy to pass judgments. It's so simple. And I said, this is the time to watch. But they are not watching. I essentially believe that 2 things in life are most important. You spend them very carefully. One is money, other is time. Money you can get back, reinvest. Time you cannot get back. So the problem is that when you are wherever you are, I essentially believe focus is important. We are very interesting people. When we are sitting in the hall and somebody is talking, we are thinking of something else, the cricket match or the exit polls. But when we are looking at the exit polls, we are thinking, what must be going on in that session? So it's a question of misplaced priorities, and that's what we essentially believe. Ramesh, am I going on track? So it is just, and you know, thank you very much. That's why I love him, because I'll come to you also. You are my last topic to discuss. I'm coming to you also, don't worry. So I think the power of focus is most important. When to focus, when not to focus. Me and Ramesh, our common guru, Dr. R. Kataria, one of the greatest surgeons in the world I've seen. I've traveled all over the world. I haven't seen a surgeon of his class. Surgery is not about the flair. He knew when to go fast and when to go slow. The ability to concentrate, when not to concentrate. Another thing which is a terrible impediment to our progress is our assumptions, is our beliefs, the confirmation bias we have. I'm done. So, if you are not willing to change your opinion, you will never learn. The day you stop mistaking your interpretations as facts, you will succeed. Everything in life is changing. Today robotic is good, tomorrow it may not be good. I used to say pancreaticogastrostomy is the best anastomosis. till 2 leaked and patients died, so I changed. So be willing to change. Everything is, don't base your knowledge on assumptions, go after facts. And thank you very much for listening to me.
Thank you, Adarsh. And can I have GN now? We need some slides, audio visual, because...
Happy morning to you all. I don't hear. Happy morning. Happy morning. Yeah. Thanks, Ramesh, for having me here. It's a privilege. I'm sorry I could not join you yesterday. When I see the crowd in front of me, I need to share a few thoughts on my journey so far. As I stand before you today, I know I'm standing on a threshold of a challenging leadership, a phase in life which will throw up challenges as far as leadership is concerned when I take up the post of the Rotary District Governor next year. But that's a choice that I have brought on to myself. But I want to talk to you about a few templates which I believe are important, are really important. Because excellence is never a destination, it is a journey. A journey, for me, so far, it has been 3 or 3.5 decades. For some, it's more, for some, it's shorter. For many of you, it's been short so far, but you know you have got a long, long way to travel. But in the medical profession, all of us, most of us, tend to get stuck in a groove. The groove starts in our medical school, goes on in our post-graduation, the OPD, the cases, the surgeries. Then, of course, once you break out of the medical school and the training program, the money, money, money. And more about personal satisfaction, the I rather than we. I believe that for all of us medical professionals, it's very, very important that we need to actually stand, pause, reflect on ourselves and see which are the areas where we can do something different. The first template which I believe is very important is we must learn to think out of the box. Ask yourself the question, why should I restrict myself or my activities, my thinking, my philosophy to just one small box? For some, the box is small, for some, the box is big. But the box should never be the limitation because each one of us is capable of big thinking. It is we who place the restriction on ourselves and think small. Our activities should be much more than the usual regular affair of going to the hospital, seeing cases or doing a journal or whatever it is. As Robert Frost famously said, 2 roads diverged in a wood and I took the one less traveled by, and that has made all the difference. And that, my dear friends, is probably the most important decision that you're going to take in your life. Which is the road that you would like to travel? The second is the power of we through the power of I. And I'm referring to a simple thing called teamwork. When I came into Cochin, I joined as a standalone gastroenterologist. I was a king in that institution. I moved and I joined a big team that had moved in from Kutatulam, Dr. Philip Augustin's team. A lot of people ask me, why are you doing this? This is a suicide. You are your own king. And now you're going and joining a team where you'll get submerged and you'll lose your identity. But today we know that gastroenterology, medical or surgical, succeeds because of teamwork. We need to grow teams. We need to grow institutions. You know, glorious examples like Naresh Trehan's, the Reddy, the Nagi Reddy, they're all glorious examples of people who've grown institutions. They've evolved into the path of leadership. I'm sure there are at least 50% of the people sitting here who are capable of being leaders in their own professions. As Swami Vivekananda said, all the power is within you. You can do anything. And believe me, it is challenges that actually bring out the best in us. It's the challenges which tell us that we are capable of much, much more than what we think we can. And therefore, this line of thinking that I am here in this world for something much, much bigger than what I'm doing now. And that can only happen when we broaden our vision. We broaden our vision to the extent that we start thinking of things, and you have to think of impossibilities in order to make it possible. All the discoveries that have happened, we know have happened because of that. At one time, they were impossible. Today, it's possible. And it all centers around how big is your frying pan. This is a story of a jogger. Every day morning, he would go jogging. One such day, he was jogging. He saw a fisherman. He moved closer and he found something very surprising. The fisherman, what he was doing is, each time he would catch a big fish, he would throw it back into the pond. Each time he would catch a small fish, he would put it into the icebox. The jogger asked him, I've seen so many people, but this is the first time I'm seeing a person throwing the big fish. The big fish are the best ones. So the fisherman replied, what to do? I also hate doing what I'm doing, but the frying pan that I have at home is a small one. It cannot accommodate the big fish. And he was talking about all of us. It all depends upon what is the size of the frying pan that we carry. The bigger the frying pan, the bigger the fish. Opportunities will keep coming, but it is for us to grab them. And we can grab them only when our frying pan is big. And finally, I would say that whichever stage or step you are in your profession, you must learn to stay relevant. And how do you stay relevant? Change with times. A glorious example, my friend H Ramesh here, surgeon by profession, but still he has a better knowledge of medical gastroenterology than most of us medical gastroenterologists. Because he stays updated. Stay updated, teach, share. Catch hold of the residents and share with them. Take classes. That's the best way you can stay relevant. Stay relevant to your time, stay relevant to your profession, and that will help you dream, believe, visualize, and achieve. These are the 5 templates that have evolved me into my way of thinking. I'm not saying for a moment that this is the right one, but still that has taken me to the point where I am today. And as I am standing here, I look forward to a much better tomorrow for me. I hope tomorrow I can wake up as a better version of myself. Thank you.
Thanks, Jian, and not but by no means the least, Rajeev.
I believe that we're all different people, and if you put a rabbit, a fish, and a giraffe and a squirrel in the beginning of a race, it's not a fair race. So we're all different people with different perspectives, different skill sets. So I don't personally believe that a person is more successful than the other. So that's my intro. But I congratulate Dr. H Ramesh for the excellent panel discussions that I was telling him yesterday. Yes, because we were able to hear what was going on in people's minds. And these are sessions where people speak their minds. So I congratulate you for doing this, and also for the nice words you spoke. So I'll present in the 7 minutes some skills I've picked up over my journey in so many different countries. This is what I trained my daughter in. She's 16. So I tell her, for everything, I have no slides. I have no slides. For everything you do, have a plan B. It's a very simple principle, but it is profoundly underutilized. Whatever you do in life, always have a plan B before you start doing it. You don't think of plan B after it fails. And it can be changing a light bulb. I train her to change a light bulb. I say, okay, you change the bulb. So I tell her, so what are the things that can go wrong with it? Have you thought about it? So you could fall off the stool. You could get an electric shock. So have you turned the switch off? Yes, I have. What if there's another switch? What if it's a two-way switch? Oh yeah, I forgot that. Okay. Have you placed the stool in a stable position? All right. What if you fail? What if you can't do it? Do you have a plan B? Okay, I am your plan B. Right. So that's how I trained her. The light bulb is a simple example, but it's a metaphor for everything in life. So I echo what Dr. Adarsh said about time management. I am very stingy with time. I'm a miser. 1,440 minutes I have. I value other people's time, so I stick to my time. So these 1,440 minutes I use like currency. Trust me, I do that. So I don't, just like I don't let people steal my money, I don't let people steal my time. It might sound a little harsh, but we are all born or given only a finite amount of time. And don't let other people steal it. People can steal it in strange ways. Simply scrolling on social media, watching reels, some person doing a video show on something. No. If it's not enriching you in one way or the other, don't fall for it. So that's something I do. So I stay focused like that. I keep my blinders on. I keep politics and religion out. So it keeps a lot of clutter out of my feed. I also look at opposing opinions. I use social media mainly to look at people who disagree with me, and I engage with some of them who are polite enough to give a different opinion. I also check the comment section below posts because that can give me a new way of looking at things. Because unless you are just like this session, unless we are looking at somebody else's thoughts, how will we progress? That's the way I see it. For 10 years, I trained communication skills. I was a trainer for Kerala State IMA. But my sessions, what I did were slightly clever in the sense, if I was doing a communication skills for this group, I give a intro in the beginning and say, look, at the end of this, I want each one of you to provide one tip that you learned in your life. And I would write it down in a piece of paper like this. You know, people who know my style, I write notes. So those notes get incorporated into my module, and the next time I present it, it's a different module. Because these are priceless tips that come from decades of experience, which I would never get otherwise. So my module grew over the 10 years, and that helped me profoundly. That's one investment I made. So it is like a business. I give the skills, I learn skills. So that is a good session. Otherwise, all my modules would be the same. People who listen to the modules have said, every time I listen to you, you say something different. So that's one. The other investments I've done are language. I was state second rank holder in Kerala State SSLC. So I walked with a swagger into CMC Vellore, and I could barely speak a full sentence in English. Compared to my peers from Bombay and Delhi who were so well-versed, it was like they were born into English. And I had to struggle to translate from Malayalam to English. So it took me 6 years to become fluent. By the time I got into MD medicine, I was able to speak, but with a Malayali accent. That I had to train very hard to overcome, because when you speak on a global stage, we need to speak with what's called a global accent, that a Japanese person can understand, somebody from Bulgaria can understand, somebody from Britain has no trouble following. So I made heavy investments into that. I invested into my speaking skills. So I trained with some of the good people in the US during my time there. And we had groups like this where we would stand there and deliver, and then you would criticize. And then the wheel goes around. So that is a very nice exercise. So those are two big investments I made. I don't keep goals. I don't look for, I want this outcome, I don't want a position, I don't want an award. I've turned down so many awards, I've lost count. I just don't believe in them. I simply don't, because I think they distract me. So that's just me. I'm not asking anyone to be like that. I learned something from a woman called Uma Preman. You would have heard of her in the transplant setting. She's a social worker, well known. She's close to the Prime Minister now because she's so good. She gave a talk at our IMA and she said, long ago, she said, over the years, she's a beautiful young woman, she became a widow, and then, the consequences you can understand. She said, you must never give excessive respect to anyone. That struck me. I said, yes. Don't fall at people's feet. Treat people with courtesy, with basic respect. Don't fall at their feet. So I followed that ever since. It's never let me down. So my time is running out, so I will stop here with my 80-20 rule of productivity. If the cycle is 100, 80% of the work is achieved in 20% of our time. So in each of our days, we have a productive window of time. That's when our currency is much more valued. Use that time very well and don't throw it away to other people. Like my productive time, I know when it is, so I use it for my most intense work. So I can get 3 hours work done in 10 minutes sometimes. I'll stop. Thank you.
Thank you, Rajeev. And now you've heard from the three greats, and I invite the audience to ask them all kinds of questions. And of course, at the end, I just want to leave myself a few minutes to ask a few questions. But then Adarsh has something more to add while you frame your question.
I want Ramesh also to speak. You also speak. No, you should also, you go, no, you can't say that. Am I three of us agree, no? Go ahead. No, you. Go. We got 5 minutes. No, we give 5 minutes, you speak for 3 minutes. Some people are so stingy about their success methods, they don't want to share. It's so unfair. You call people from outside and... Order request. It's so unfair.
Dr. Adarsh Chaudhry, I would like to quote Dr. Mahesh, who is in the audience, who said, and I'm going to speak in Malayalam, I excuse those who are not from Kerala, that, സാറ് വരുവാണോ അപ്പോൾ എന്ത് പറയുന്ന അറിയില്ല. In the sense that the translation is that he just tends to change the script. So these are the greats who can change the flow of the river, change the flow of discussion. So the aim of this whole exercise is that, whether it's Jesus Christ or Khalil Gibran, they said the prophet is never recognized in his own land. And I've been struck by the fact that I remember, others getting an award in Kuala Lumpur, and for that, therefore we could not meet at a meeting. And it struck me that it never happened in the IASG, for instance. And I could never understand why. Why can't, I think it may be a national failing that we tend to decry our own people and idolize somebody else. Idolizing somebody else is fine, that's your choice. But why decry your own, why should you not be a prophet in your own land? So the aim of this exercise is to bring before you some people whose lives have enriched me and who have the potential to enrich your life. And you should not change the focus of this discussion. Perhaps at another moment we can reflect on these things. Obviously, I'm a product of all these. I think there was a colleague of mine who works now in the UK who said, this guy changes practically every day. And probably that's the only thing that's kept me going. The only constant thing in my life is change. I learned so many things from so many people, including, audiovisual people, from my residents, from practically everyone, even from a little vendor on the street, because there's sometimes a charming smile tells me that maybe I need to put on my smile. I don't need to sort of be grumpy as I go through the day's work. So I've learned so much, and I continue to learn, hopefully. And here are three of people whom I have dipped deeply into the well of their experience. And I wish you all the best. And I don't think it's proper to let others change the script. And I can firmly quell his revolt. Thank you anyway for the request. Questions, please. Please give him a mic, please. It'll be recorded and live streamed. Otherwise, it'll be missed. The others won't.
It's for all four of you. I've been fortunate to be the student of Dr. H Ramesh and tried to mitigate his way of working. I just want to know, I felt over a period of time that I feel burned out sometimes. I sometimes really regret I should not have taken GI surgery. It's called a surgery of complications, kind of. You do a lab coolie and it takes sweat out of you sometimes. Instead of that, a urologist, I feel like he walks very happily. How do you guys cope up with the stress when your patients don't do well? And unfortunately, I have a colleague who is more obsessive with that. He'll call me at 10 o'clock, 11 o'clock. This Whipple patient is having a fever. The liver transplant patient, enzymes have gone up. How do you guys come out of that? Because it affects my social life. I become a bit more grumpy with my wife, with my kids.
Shiraz, I can only tell you that you are a rule rather than an exception. And this problem of burnout is something that is very common, and we've been trying to address it. You can imagine in the States, 50%, 60% is the rate at which people burn out. And the reason is very simple, the stress and strain of daily life. It's always like this, where you said surgical gastroenterology is this thing of complications. The neighbor's house is always better than yours. Now, you live...
Did you say the neighbor's wife?
Oh, I have changed that. I have deliberately changed that, so to maintain propriety. But this is what it is. You get used to a particular way of life, and obviously the journey is never going to be without any problems, whatever specialty you use. The best way to sort of quell this problem of burnout is the one that I mentioned in the beginning: chase your passion. Think outside the box, do something different. Let you not get into a groove where you're just working for the daily, on a day-to-day basis, but think of something different, doing something different. On a personal front, I started doing something different quite long back. My passion was music. I started singing. My passion also was to do something, to think of something different, a different angle, wear different glasses and watch. I started the Cochin Gut Club, which he referred to. Then we had started the Gut Crackers, which was another attempt to look at academics in gastroenterology, mix it up with non-academics or other issues in medicine. We were talking about different things, and we also discussed about burnout, various other issues. So I think the secret lies not in getting burdened by the daily affairs, but in planning and doing something different. Complications will happen, and I think we are going to discuss that. I think setback, HR's plan or script for the morning did mention about a discussion on success and failures. I hate to say failures. It should not be called failures. It's all setbacks. Setbacks are all temporary. Everyone goes through that. I have gone through, I have had my fair share. So I think the way you get out of that is be philosophical, forget it, let them be stepping stones, and move along.
Would you like to say something in response to what Shiraz said? And
I'm a Punjabi. We have very low IQ. If you don't like it, leave it.
Chadiyar.
Who asked you to do liver transplant? Who asked you? You did it. So if you are there, you have to face it.
The vicar of Wakefield said, if you
simple.
make your bed, you have to lie in it.
Yeah, you chose it. Nobody is forcing you. I drive from Delhi to Gurgaon every day. People said, why don't you live in Gurgaon? Why should I crib? I chose to live there. You start doing IND, start lancing abscesses, just do vasectomy, go home and sleep. You want to do it? Do it.
That's not the way forward. Like, leaving it is not...
You want to go forward also. You don't want to have complications also. You want to do that also. So you're not an angel. You're a human being. So we have to be a realist. You can't every day score a century. I had a patient, a guru, who had CS stomach, and we operated on him. So I asked him that you are a bachelor, you never smoke, you never drank. How come you got a cancer? He said, you are more worried about me than I am. So I asked him, what are your 2 lessons of life? He said, those 2 lessons changed my life at least. First, he says, acceptance without exception. Second, he says, do you watch cricket? I said, yes. He says, when Sachin Tendulkar gets out for 0, what do you feel? I said, I feel very bad. When he scores 100, what do you feel? I said, I'm very happy. He says, take the word very from your life. Extremes cause problems. If you sit on a camel, you go bound to face oscillations. So you do liver transplant, there'll be problems. So you have to face reality. Yes, you feel bad, but such is life. Some days you are the lamppost, some days you're the dog.
Great. Rajeev, do you have something to add? That's fine. So I also say that, I have spoken about this before, and I'm happy to sometimes talk about it, not now, that you need a broader wheel of life with more spokes. If you have just the one spoke, that is your surgical activity, then that spoke will break one day. So you need many spokes, and Jian said it in a different way, but it's pretty much the same. Any other questions?
So you all grown in a time where there were lack of, the specialty has not at all grown. Now, lot of people are there, lot of opportunity, there are, the people are striving for an opportunity now. So how do you feel that, how the young people should go on in that scenario? Because many of them are trying to get a placement, many of them are trying to get a, even though they get a placement, they don't get their hands on or something to do, work or something like that. Yeah, whoever, it's like, so what is your message to the young generation in this aspect?
I really cannot answer your question because it's very difficult to answer this question about opportunities, but I can, if you want, I can make you laugh. I can tell you a message I heard long time back. I'm a collector of humor. I.S. Johar used to write a column in Filmfare, and those days Hong Kong was being incorporated into Commonwealth or go to China. So somebody asked him a question, what is your advice to young Punjabis in Hong Kong? He said, young Punjabis need Chinese girls, not advice. So opportunity, I don't know how to create, I don't understand.
It's only the fabric has changed, but essentially the rules are the same.
Generations will change, times will change, everything will change. I think you should be happy that you're born or you're working in a time frame where there are a lot more opportunities than what we had. Of course, along with opportunities comes competition also. So now, whenever you have opportunity, the competition is high, you need to be obviously more competent and you need to make your selection very, very, very precise. What I would suggest to you is, yes, whatever decisions you take, stick by it. There's no wrong decision as such. There are tough decisions, there are light decisions, but there are no wrong decisions. So you take a decision, stick by it, shed expectations. Don't expect people that people will do this for you or something will happen. You have to do your own work, you have to do your own good. I don't think there's been much change other than the fact that the canvas has become much bigger, the colors have become more, and it is actually a much more rosy picture than what we had 2 or 3 decades back.
The problem is that on a surgical side, we don't have an escalator to success. That's the biggest problem. Everybody wants to become H Ramesh, little realizing it takes a lot of time.
Not only in surgery, I think
we want to see the child, don't want to see the labor pains. So it has taken lots of years, and there are lots of struggles, and it takes a lot. But there are more opportunities today, and there are more operations to be done today, more skills to be taken today. So things are better also today.
Would you like to add anything, Rajeev? More support systems, for example. While you compose other thoughts, I wanted to ask our 3 panelists a set of 5 questions. And I want them to give monosyllabic answers if possible. Of course, they can dwell on them. What do you think is the most important quality one needs to possess to become a successful medical professional with a good work ethic and a work-life balance? And this is a major challenge. You can be one or the other, but to be both, you can use a long reply, but as brief as possible. Each one of you.
The one word answer, my answer is empathy. And we all saw the slide yesterday, the view from the cross. I think that shows, I think Dr. Jian will fill you in on that. I think that's the most important, that we must be able to see things from the other person's side. It takes effort, it's not easy. And the poem, The Fly, which we learned in school, was helpful, because the poem said how big the world looks to a fly. You know, I can't remember, a flower may seem as big as a mountain. So for the patient, how it looks, to understand that. And a simple example I can share very briefly is, especially in Western nations, if you walk into a building, there are 2 glass doors because they are heat insulated. You push it in, you walk inside, you are expected to hold it open for the next person. Going from India, I was not used to that. So I could have been perceived as rude, because if I just walk past the door and let the door swing back, I'm expected to hold it open. But not permanently. If there's someone right behind me, that's basic courtesy. I have to be able to see that person's perspective. So that's the simplest teaching example of empathy I use.
That's upbringing more than empathy. Empathy is more inborn. You have it regardless. You would do it even if you came from India, I would like to argue.
You mentioned about work-life balance and ethics. I think two features that are 2 characteristics. One I referred to a little while ago. Work without expectations, work beyond expectations. That is one. The moment you start expecting things from outside, that expectation actually is bound to disappoint you. So, and it's going to result in unethical practices. So, work without expectations. And second is, you should be your own competitor. Don't think that someone working with you is your competition. Don't think that someone working in another hospital is your competition. You have to be your own competitor. Become a better version of yourself, improve on that front. The moment you start looking at your profession in these 2 angles, you will automatically become a supreme professional.
Thank you, Adarsh.
I think the most important quality is humility. If there's one thing which is kind of takes everything away, is arrogance. Some of us think there are 3 kinds of surgeons. One is CMG, other is KCMG, third is GMG. CMGs call me God. KCMGs kindly call me God. GMGs, God calls me God.
Actually comes in yes, minister.
So, yes, I think humility is most important. All glory is fleeting. You get an award, you get an oration, you become a president. You stand on the dais for 5 minutes. Nobody cares. I had a poster in my room in PGI, which was most important. No matter what you do, 10 billion Chinese don't give a shit.
Actually, I'm really impressed, because the quotation he took was from a Yes Minister series. I don't know if you're the popular bureaucracy, the soap opera Yes Minister, and I wouldn't have been able to translate that into surgeons, and I think that's absolutely...
Ramesh, it's a Bible for us.
I appreciate.
It's a Bible for us.
I accept it completely. Is there a role model lurking somewhere, Rajeev, and the rest, and 3 of you?
No, I see role models in other people, so I pick what I appreciate from each individual.
No, yes.
No, not a single person, no.
No, not a single
No single role model.
So you're a little like my article I wrote, that I didn't see people, but I saw qualities.
Bits and I pick up the bits.
Much to GN's disappointment.
Ditto.
Ditto.
Bits and pieces role models, that's what I would say. There are lots of bits and pieces. I think the legends or so-called legends sitting here, standing there. But the closest to that, let me tell you, let me fix up this thing. Closest to that would be Nagi Reddy. For the humility, for his knowledge, for his leadership skills, for his team building skills, and for whatever he has achieved. I wish I could do 10% or
It's a great
15%.
example, great example. So, lots of people said about how they dealt with failure. I think GN dwelt on it at some extent, and the other two also. But how do you deal with the intoxicating wine of success when you are, you're given, you don't care a shit, you said, but it's easier said than done, that somebody gets a big award and then they are flushed with the excitement of that, and then their future actions go downhill simply because they just lost their sense of perspective, and they simply fail to realize that they are come back to work the next morning and they've still got to do tick the boxes. Your comments.
I'm very fortunate. I never got any great awards. I never won any elections. I have no international recognition. So I cannot answer this question. I've never got any awards, so I cannot answer this.
Success is not awards. Actually, success
No,
is also
I just gave us very stupid.
Awards is just a yardstick, which is a very, very poor yardstick.
I gave
for
a very
success.
poor example, but you know what I mean.
I know. But definitely, there are always ups and downs. There's never up and up. There will be. Whenever there's an up, there is going to be a down. Success is always a temporary feeling. He was referring to being the president and being on stage 5 minutes. As long as you occupy the chair, people will respect you, and the moment you're off the chair, that's it, gone. So I think the best way to deal with success, it's a part of life. You know that a setback is following. You know that it's not going to be rosy. Like in cricket, a person, Virat Kohli, would have hit a century the previous innings, but he has to start from zero, doesn't he? He has to negotiate all those tough deliveries in the beginning itself. So success is always just a very relative feeling. It is temporary, and we must understand that it should not feed our ego. It should be a motivation for us to do something better.
There was a Polish poet. Today I remember his line. He said something very beautiful. He said, "Never turn your back on somebody because you may be painted only on one side."
So my final question to
Can I add that?
Yes.
I'll say the opposite, that's on failure. Something I learned from Parveen Hafiz, who's my close friend. She said, she runs a hospital. So she says that she doesn't use or acknowledge terms like complication or mistake. She says she uses a word called situation. There is a situation, because the word, I heard Dr. Shiraz talk about complication. No, that's a man-made term. Many of these man-made terms have emotional connotations with it. They feed into your limbic system and they pull you down. They bring your energy down. It's a situation. It is what it is. So I would convert failure into
A situation.
It's a situation. And I'll finish by quoting Jeff Bezos, whose ideas, some of which I assimilate. He said many things that are profound. What he said was, how do you know an idea will fail until you try it? There you go.
Thank you. And my last question is, and this is I encourage the three of you to think wildly. If you're born again with the same brain and the same body, what would you like to become? And you don't have to, you can say whatever you like.
That's a tough one. That's a tough one. It's very easy to say that I would do the same things that I did in life, but yes, if I were to, I have had my own share of setbacks. I've done my own share of mistakes. So if I were to be born again, I would probably revisit that whole thing and learn from, take all those setbacks as learning lessons, and whatever the negative things or mistakes that I've done as things that I should not be doing. To be on the more serious front, yes, born as a, no one is born with a silver spoon, no one is born as a medical professional, but medical profession is a wonderful profession to be in because that is where you can exhibit all forms of good things that one is expected out of a human being. Empathy, kindness, help, succor, everything. So I think I would love to
Be a
chase whatever I did.
Adarsh?
I'm just between two things. I want to be a fitness advisor to Bollywood stars.
Okay.
That's one of the desires I have. And second is I want to be a black belt in karate,
Okay.
if possible.
You can be both, I think.
Yeah, maybe.
Yeah, maybe. I think you should.
I have no keen interest to be reborn as a surgeon or something.
No, but I think you should
something.
clearly keep it in your mind that you want to be both of that because you never know, it may happen. Yes.
I would not change a thing, but I'll add one more thing here, that with the brains that I'm born with and the body I'm born with, if I'm sitting here, it is because of certain events that occurred randomly during my life, and that's true with, I believe, most of you. The biggest successes, including, things like Amitabh Bachchan's success and Yesh Das's success, all of these and very rich people's success have got to do with the single investment or the single meeting that happened to occur at a given place, or some actor walked out and then he was there at the right place at the right time. So being at the right place at the right time made us what we are, and that I think that should make us humble. It's really not the hard work or the intellect that got us here. That's my perspective. Thank you.
And on that note, if there are no other pressing questions, I'd like you
Ramesh,
to...
what would you like to be?
Frankly, I never think.
No, you have to think. Please give one answer. That we know you never think, but today you can.
Anyone else? I mean, I don't want to be disrupted because I
A
just don't...
tough return catch.
Yeah, but, the point is, maybe the secret of my existence is the ability to blot out any such thought. Maybe that's an important, if it's a lesson, it's a lesson.
You may not be a legend, but you're a micro legend. But at least tell us, what would you like to be if you are reborn?
I'm not really sure. I've never given it a thought. I probably will send you a message soon, thinking about it. Is there somebody said the resident had a question? Okay. Thank you very much, panel, and wish you good health and long life and all the very best. And I'm sure the audience wants to show their appreciation. I think you can grab a cup of coffee if you want, if John allows it for a couple of minutes before you start the next session, or you can have it simultaneously.